Talk today about why gut hormones are an underlooked cause of chronic diarrhea. Approximately 5 in 100 people in the UK live with chronic diarrhea. If they go to their GP to find out what's causing their symptoms, they will do a few tests for them. This will include a blood test to look for celiac disease. This will include a stool test and an additional blood test to look for signs of infection or inflammation, such as if inflammatory bowel disease could be underlying their symptoms. And they may also be referred to a specialist who may wish to do a camera test to look inside their gut to assess that the gut is healthy and find what might be causing their symptoms. Now, if all of those tests come back normal, the patient is likely to be diagnosed with irritable bowel syndrome, which approximately 3 in 100 people live with in the United Kingdom. But also, all of those tests will come back as normal if they have another type of condition called bile acid diarrhea. These participants produce too much bile that enters the end of their gut and causes their symptoms, but they are often misdiagnosed as having irritable bowel syndrome, despite them having additional treatment options for them. So where do gut hormones come into this? You've all likely heard of one gut hormone. GLP-1, the Instagram hormone, as I like to call it, is the one that the weight loss injections are based upon because it makes you feel more full. But there are up to 20 hormones in the gut, and they're all found in different places. And 2 of them increase the speed at which things move through the gut. So with my prop, in the small intestine, the small bowel, you have a hormone called motilin that has a very appropriate name. It does what it says. That increases how fast things move through the gut. And also right at the end of the colon, which we have here, you have a very badly named hormone called insulin-like 5, which also increases the speed at which things move through the gut. Now, if bile acids enter the end of the gut, that causes the release of this hormone. And also, if this hormone is administered to animals, it results in dramatic increased movements and an urgent bowel movement. Now, in our lab, we now have ways of measuring this very difficult to measure hormone, insulin-like 5. And what we have found is that in healthy volunteers, it is low and below the limits to which we are able to measure the hormone. In this condition, bile acid diarrhea, which does not have a blood test for it, we have found that it is raised in 8 out of 10 people with the condition, but also more curiously, in patients with irritable bowel syndrome who we have screened for bile acid diarrhea, 4 out of 10 of them have this hormone elevated as well. And to give you scope as to how tiny the level of this hormone is, it's the same scale as if we are trying to look at our bike from the moon, provided that bike has not been stolen. It is Cambridge after all. So, where do we go forward with this research? Well, we need to understand more as to how this hormone is causing the increased movements within the gut. We want to see if there's use as to whether this could be a test to help diagnose patients with bile acid diarrhea. We want to understand why some patients with irritable bowel syndrome but not others have this hormone raised, and could this be an interesting subset? And also, this gives us a new avenue for what future treatment options could be designed for to help treat this patient population. Thank you.